Okay, I'm going to be administering IV medication via minibag. First, I'm going to verify the physician's orders. I'm going to verify the medication, which is Rocephin. We're going to be administering 1 gram IV daily as directed over 30 minutes. The available is 500 milligrams per milliliters, which gave me 2 milliliters to infuse over 17 drops per minute. The safe dose of Rocephin is 1 to 2 grams once daily. The action is that it binds to bacterial cell wall, causing cell death, cephalosporin 3rd generation. The treatment is for UTIs, skin infection, and respiratory infection. The side effects include GI upset, fever. Contraindications are if the patient is allergic to penicillin, cephalosporin. It can't be hung with a calcium IV. If the patient has hepatic or renal disease, if they are anaphylactic, or if they are pregnant and breastfeeding. The labs we're going to assess are liver and kidney functions, the AST and ALT. The BUN should be at 7 to 23, and the creatinine should be at 0.6 to 1.2. The math that I did is right here. Okay, so first I'm going to assemble the medication. So I'm going to wash my hands, and I'm going to be drawing up 2 mils of Rocephin. So I'm going to my syringe. I'm going to clean. I'm going to pull up 2 mils. Okay, make sure there are no bubbles. Alright, I'm going to recap, and then I'm going to insert the medication into the mini bag. I'm going to clean the port. Cleaning the port. And then I'm going to inject. I'm injecting the Rocephin into the mini bag. And I can pull this out and recap the needle. And then I'm going to shake this up. And I'm going to label the bag with the drug, my initials, the date added, the time, the expiration date, and the patient, as well as the flow rate, which is 17 drops per minute. And then I'm going to hook up the tubing, which is here. And I'm going to make sure I clean, take the cap, I'm going to clean this, as well as the mini bag. Up and hang it, make sure it's labeled. I'm going to label the tubing as well. And then I'm going to prime to make sure there are no air bubbles in the tubing. So I'm going to take this off. And I see flow, so I'm going to, it is all primed, so I'm going to clog it back up and set it to the side. And now I'm going to, the tube is labeled, it's all primed. I'm going to draw up my saline. I'm going to draw up 6 mils of saline. I'm going to clean the saline. Draw up 6 mils. saline. I'm going to recap the needle and dispose of it in the sharps. And now that I have everything ready, I'm going to enter the patient's room and introduce myself. I'm Lexi. I'm verifying your name and date of birth. Do you have any allergies? No allergies? Okay, great. So I'm going to wash my hands and apply clean gloves. While I'm applying my gloves, I'm going to be looking at the previous IV site, making sure that there's no phlebitis or infiltration. It looks good. There's no redness. Do you feel any pain? No pain? Okay, good. So I'm going to begin with my ASASH procedure. First, I'm going to clean the port and clean my saline. And I'm going to connect these. And I'm going to aspirate. Oh, I'm going to unclip. And then I'm going to aspirate to make sure there's blood return. I see blood return, so I'm going to do the stop-push method for half a milliliter and then stop, half a milliliter, then stop, half a milliliter, and stop. All the way down to, I should have 3 milliliters left. I'm going to clamp the tubing and remove. I'm going to go ahead and connect my IV or my meds. I need to clean both of these ports. Clean. Go ahead and connect these. Now we know that the IV is clear and ready to receive the medication, so I'm going to unclamp. And I'm going to set my machine at 17 drops per minute. So I'm going to let that sit for 30 minutes. I'm going to assess the site and make sure everything looks okay. I'm going to do my 4 Ps and ask the patient if they're feeling any pain, get them their possessions, put the bed in a right position, and ask them if they need to use the restroom. I'm going to clean everything up, wash my hands, take my gloves off, and so I'm going to come back in the room like about 30-45 minutes later, and I'm going to flush the rest of the saline. So I need to apply the alligator pump if there were one, but there's not, or alligator clamp, but there's not one here today, so we're just going to clamp this off. Hands are washed. I applied new clean gloves. I'm going to clamp this off and separate these. I'm going to clean this port as well as my saline. And connect the saline. I'm going to unclamp and aspirate. There's blood, so we're going to go ahead and do the stop-push method. Every half, stop, push, stop, push, stop, push, until it is all gone. And then once it's all through, we're going to clamp it again. And in some cases, like a PICC line, the doctor would order a heparin, or the hospital would order a heparin, and we're not going to do that today. So I'm going to disconnect this saline, make sure everything's clean, and assess the site and make sure there's no infiltration or allergic reaction to the drug. I'm going to ask the patient again the 4 Ps, the position, the pain level, the possessions, and if they have to go to the bathroom. I'm going to get everything cleaned up, and I'm going to use the MAR to double check everything, and I'm going to record the time, the drug, the dose, the route. I'm going to state the condition of the IV site that was just given the meds through, and I'm going to record the volume of fluid used to deliver the medication in the mini bag on the MAR, which will give me my intake and output. I'm going to wash my hands, and dispose of everything.